All right, let's get back to the big story. Over 58,000 cases have been clocked across India in the last 24 hours. The top cities of Mumbai and Delhi continue to lead the COVID-19 surge in what could very soon become the third wave across the country. So 10,000 cases clocked in Delhi over the last 24 hours. The figure is 15,000 for Mumbai. Hospitalization rates are relatively low. And this is something that the government and the health ministry reiterated in its regular briefing today. Another very important point which was raised was that any booster shots that will be given, and initially they will be given to healthcare workers and those above 60 with comorbidities, will be the same vaccine that you've taken before. So if you took Covishield before, you will get Covishield as your third shot if eligible, and likewise for Covaxin. Another important point, the first Omicron death was registered in India. A 72-year-old gentleman was found to be infected with Omicron after he passed away, and he had comorbidities as well.
The precautionary vaccine dose that will be given to healthcare workers, frontline workers, and individuals 60 years and above with comorbidities will be the same vaccine as has been given to them previously. Homologous third dose, homologous precautionary dose. जैसे जैसे और इंफॉर्मेशन मिलेगी हमारे वैक्सीन्स के बारे में, सो कॉल्ड मिक्सिंग की, सो कॉल्ड हेट्रोलोगस अप्रोच, वो जैसे जैसे डेटा सामने आएगा, साइंस सामने आएगी, इसको हमारी साइंटिफिक टीम्स इसको रिव्यू करेंगी और अगले फैसले लेंगी.
All right, today on the show we have Dr. Rahul Pandit, who's a member of the Maharashtra Covid Task Force. Dr. Suneela Garg is joining us. She is a member of the COVID-19 India Task Force for the Lancet Commissions. Dr. Bishnu Pangrahi, Group Head Medical Strategy and Operations at Fortis Healthcare, is with us on the show, as is Dr. Ishwar Gilada, Infectious Disease Expert. Welcome to all of you, and thank you so much for speaking with us today. Dr. Pandit, let me just begin with your overview. I know the message so far is that we must not panic, and that is absolutely correct, because even though many of us perhaps have learnt of several people, each of us know, who've tested positive in the span of the last 24 hours, mostly people are safe, they have very mild symptoms, and the hospitals are not clogging up. My question to you this evening is, how do we get this surge to plateau out before it wreaks havoc?
Okay, so good evening, Tamanna. It's always good to be on your show. I have a submission to make here, that the first wave was about lack of PPE kits. The second wave was about the shortage of oxygen. I am fearing that the third wave would be about doctors and nurses and hospital administrators and everybody actually falling ill with mild illness and not being able to actually attend to the patient. That's my biggest fear, and that's why I think to plateau this curve is very, very important. And I feel there will have to be a multi-pronged approach. Just one approach is not going to help. So a lot of IEC still needs to be going on and done about the COVID appropriate behavior. No matter how much we have done, we still need to do that. And we probably will have to have some sort of a small circuit breakers, maybe something which will actually logically bring down the crowded congregation. So we might have to put in more restrictions to crowded places. I'm not talking about stopping work and going on lockdowns. I'm talking about having a calibrated approach where the crowded congregations are stopped, so that at least it plateaus out and then it starts to decrease. Well, whether that would happen or not, only time would be able to tell, whether, because the infectivity is so high, despite all of this, we may still see the cases surging up. So it's a question mark right now at the moment as to how are we going to be over the next couple of weeks or so.
Dr. Pandit, there have been quotes in the media in the last couple of days saying that if Mumbai crosses 20,000, then even harsher restrictions will have to be considered. At the rate at which we're going, it won't be surprising if we cross 20,000 by tomorrow. We were 10,000 yesterday, 15,000 today. So it's a matter of a couple of days. What would define as even more restrictions?
So we are very clear. So obviously numbers is one of the ways to look at it. But we are very clear that we are still looking keeping a very close eye on the hospital occupancy, the ICU occupancy, and the oxygen utilization, which I think are the main goalposts right now to look at. And at the moment we are okay. Yes, the numbers have gone up, and number probably might go to 20,000 or less or more tomorrow. But the situation is fluid. It's evolving every day, and every day we are having discussions with the administrators to see whether they would like to have a different approach in terms of putting up restrictions or not. So this is something which has been debated and discussed every day. Obviously, nobody wants to put up a disrupt and a knee-jerk reaction there, but we want to have a reasonable amount of control over the situation in the next few days if we can. That is for sure.
Dr. Bishnu, I want you to take on from what Dr. Pandit said, which I think is a very key point that nobody is discussing. Are we going to see a shortage of medical fraternity and medical staff? Because even if vaccinated people are getting infected by Omicron, and even if it's mild, a doctor or a medical personnel can't go out and treat patients if they have to be isolated. And that really is a scare, isn't it?
Tamanna, thank you for inviting me for this show. And I will echo with what Dr. Rahul Pandit really mentioned. And since Fortis has a network of hospitals across the country, and in the three major hubs, whether it is Mumbai, the Delhi NCR, and in Kolkata, we are already getting hit by this. And this is a major concern that is there of being short of the doctors, nurses, even the front office people. So this is a thing that we are, it's not that acute at this point of time, but as they say, morning shows the day. So what we have done is that we have started staggering our workforce also in a way that, so that we are not left shortchanged if there's a huge surge. And the only good thing is which, if I can put across, is that when you look at our hospitals, the number of admissions into the ICUs and people requiring oxygen are very minimal. So this is something that we are tracking. The positivity rate has gone up definitely because it's a very transmissible disease. But the collateral damage that is happening, which can sort of overwhelm the health sector, speaking from Fortis, and it is the same thing with others also, is the health workforce can be in short supply if this continues for long. And as Dr. Rahul rightly mentioned, I think so we have to see that we follow COVID appropriate behavior, and the crowding has to come to an end. With the government has to sort of clamp down, and I'm not talking about a lockdown, but some sort of a sanity has to be brought in with these huge crowds. Whether you go to any market now, and half of them are not wearing masks. So I think the masking is the most important thing, that the message has to go out. And those who have been vaccinated, obviously the healthcare workers will be getting the booster dose. But the other message that I would like to give is that booster dose should be opened up for everyone now, because we have to start keeping people safe. And what has been seen is that those who have got booster doses, even if they've got Omicron, they have been mildly affected.
Yeah. You know, we spoke about this on the show yesterday as well, where we said that election rallies need to really be stopped right now. We need to get a reality check of what's happening, and some of those steps are being taken in some areas, and you know, we're glad for what we get. But the question of what are you going to do if doctors start falling sick? Dr. Gilada, you want to come in on that?
Yeah, Tamanna, thank you very much for having me on this show. Basically, there will be two type of shortage. Number one, there is a shortage of 1 lakh doctors, junior doctors. They are not recruited for last almost 9 months, and there has been a stay from Supreme Court. And they are the junior doctors who manages the day-to-day patients in all medical colleges, whether they are in government and private. Secondly, doctors are falling sick, and not only doctors, workers. And thirdly, even if the booster comes, at this time, booster will not help. Booster takes minimum 2 to 3 weeks to build up immunity. So I think we missed that deadline of giving booster to doctors. For last 2-3 months, we have been shouting. If we were supposed to give the same booster, a homologous booster, or even crisscross between Covishield and Covaxin, it should have been given 1.5 months back. So lastly, if the booster is given and the doctor is already incubating the infection, it is going to be some kind of counterproduction. It has been said all over the world that when the active infections are very high, boosters or any kind of dose doesn't work. So I think there is going to be a big problem. And secondly, what we say that 15% hospital occupancy. So when we say that how cases are multiplying, Currently, they are multiplying at the speed of every 2 days or every 3 days. So even bed occupancy will multiply equally. So we are not understanding. We are saying that 85% beds are still available. So I think we need to have out-of-box thinking, and that is not available. And we need to take very fast decisions. Now, coming to lockdown, I am not in favor of lockdown. Nobody should be in favor of lockdown. But there are four things: livelihood, socialization, and super spreaders. So life and livelihood can go on, but super spreaders totally no. Whether the election rallies, religious rallies, sports events, you've seen what happened in Bareilly. How can you allow sports event to happen there, and they may be stampede, but they are already exposed to COVID. And all over the country, at least when the second wave came, it was not pan-India immediately. It was in 3-4 states, and then other states got involved. Currently, it is pan-India. You take Jharkhand, you take Punjab, you take Telangana, you take Karnataka, you take Maharashtra, you take West Bengal. West Bengal positivity rate is 20%. In Mumbai, it is 25%. Don't go by just number. Only 60,000 tests are done. 15,166 positive. So with this kind of positivity rate, I don't know why we would like to see that magic figure and then decide. Actually, any kind of lockdown or restrictions are better when infection is not very well spread. Currently, infection is so well spread, you just randomly pick up phone, call 20 people, one person you will find sick out of 20. So it becomes 5%. Even if that's not 5%, 1%. 1% in India is 1.4 crore people having infection right now. So all these numbers are going to be just a hogwash, and moreover, the Omicron numbers are going to be tip of the iceberg. You have to multiply by 50 or 100 because the testing capacity is very limited. And I don't want to even say that testing should be done because it is already replacing Delta. So by this weekend, it will be 90-95% all Delta, all Omicron, no Delta. Over to you, Tamanna.
So what we're betting on right now, is that we will follow perhaps the South African pattern, where you had a very sudden, sharp rise in cases, and then it just fell off a cliff also fairly quickly. Dr. Garg, can we bet on that same pattern considering the Indian context? We are a country that is much, much larger in size, and we are a country which has fewer medical facilities and very few doctors.
Tamanna, thank you for having me on the show. It's always a pleasure. Number one, I like to say is that Ministry of Home Affairs has already issued home isolation guidelines. That is keeping in view that everybody does not need hospitalization, and we have to be really, very, very, careful about doing the hospitalizations as well. And the number 2 point I'll pick up from Dr. Gilada, what he said was that since, our Omicron variant is fast replacing our Delta variant, so, even we need not go for testing, which is going to, already constrain our already existing healthcare systems, and we do have now home testing kits also which are already available. Number 3 point is that we need to be very, very careful about how we are going to manage this situation, and looking at January 1 figure where we had about approximately 27,000 cases, and today we have got approximately 58,000. So looking at this projections, by the end of January, we'll see that the peak of the curve will be there, and then which will plateau down by the middle of February or by the third week of February. But then more important thing also, we need to look at the data itself. We have got 3 states which are providing us very high number of cases. That is Maharashtra, then Delhi, and also West Bengal. When we are looking at these, then we have to see that basically Maharashtra and West Bengal have got highest number of second doses as well. So what is, the thing which is causing, the upsurge in cases, particularly in these states, is basically lack of COVID appropriate behavior. You see, like when Delhi had applied the graded plan, action plan, again, it went back to full metros and, basically full bus and all that, which again compromises because we know that people are not following COVID appropriate behavior. So my optimal estimate is going to be that by end of January, it is going to plateau and it will come down by the middle of February, or at the most by third week of February, we must see the, fall in number of cases, and it will plateau down by that point of time. But at the same time, we must now, guidelines are already there for home isolation, which were already prepared, and the time is now to implement it.
No, the question is now how do we bring forward that plateau? because the sheer scale of numbers is what needs to be tackled. Now, Dr. Bishnu, you spoke about out-of-the-box thinking. It was mentioned on this show that there should be out-of-the-box thinking. What would that be? Where we can just ensure that our hospitals at least don't start filling up and our doctors don't start falling sick in large numbers, where we have a shortage of medical practitioners.
So number one, we should try to look at how do we do the testing at the doorsteps of people. So in the community, if I can put it, instead of them coming to the hospitals. So that is number one. Number two is that, again, back to the basics of following COVID appropriate behavior. Number three is that we have to get away and stop this overcrowding that is happening. And also, we will not be able to curb the surge because the horse has already bolted. So we can't sort of shut the stable door now. We are already in the third wave. So if you are saying that the third wave is yet to come, we are kidding ourselves because it has already come. Mumbai, it is surging. In Delhi, it's coming. Delhi usually follows about a week or 2 weeks after Mumbai. We are seeing the surge in Calcutta. So it is going to happen. So the only way that you can stop is that, the one way is that please ensure that everyone is wearing a mask, follow COVID appropriate behavior, because the virus requires the host. And the host can take the virus only if the nostrils are open. So that is the only way. So, and the other thing that's happening is, which we have not taken into cognizance, is that if we just go back and just look back and step back and look at, most of the Omicron that has come come from outside the country. So these people who have come in are the ones who have spread first. First portal of entry was Mumbai, because that is the financial capital, and then the next international travel hub is portal of entry is Delhi. So these two have been badly hit, and from there they have traveled. So I think so international travelers were coming in. I think some sort of how do we sort of take care of them? See that they are, because immediately they may not be RT-PCR positive at the time of arrival, but if they become positive 3 days later, 4 days later, but that time they have already gone and mixed with the community. So for the whoever is coming back, they for at least a week they should be segregated, and whether it's government quarantine or designated hotel where they pay for it and stay. That's the only way that I can think out of. If you ask me from the out of box thinking. And those who are coming from hotspot areas, again, when traveling between states, some sort of a check has to be there.
So you're suggesting institutional quarantine. So you're suggesting institutional quarantine for those who are traveling in from outside India, which is something that we have held off from now. There is so much conflicting information and advice on COVID-19, and that really makes the job of policymakers tough. Many believe that there's no point of restrictions because nothing really is going to stop the spread. You should in fact have boosters. Now, boosters also, at what point do you start giving them? Do boosters also help? For now, we can just stick to the basics, which is avoid crowding and mask up and vaccinate, because that's really all the tools that we currently have. Thank you so much to all of you for joining in with very, very crucial inputs as we track this battle against COVID-19. We'll take a very